Hello everyone. I am Nithin Krishnan, currently a pre-final year medical student from Government Medical College, Tirunelveli. Now I would like to explain you a topic in infectious diseases using my ClinicalKey Student. I have been using my ClinicalKey Student for the last 2 years. It really helps me to cope up with my clinical exposure which I have lost as a result of COVID-19 pandemic. Now I would like to explain a concept of histoplasmosis caused by a fungus called Histoplasma capsulatum. Actually, Histoplasma capsulatum is a dimorphic fungus. Here I would like to focus on only histoplasmosis using this ClinicalKey. How to use ClinicalKey more effectively. See, I have used a textbook called Comprehensive Review of Infectious Disease, which is a very standard textbook for infectious diseases. Here, as you can see, Histoplasma capsulatum. First, they have explained the epidemiology, where it is found most commonly. They have given you a world map also so that you can very easily recollect the areas where this disease is more common. Then the most attractive thing in ClinicalKey is about the clinical features. The clinical features are well detailed, explained, as you can see here, about acute pulmonary histoplasmosis. They have explained that there are influenza-like symptoms, rheumatological manifestation, along with incidence. That is most striking feature here. How much patients or what proportion of the patient present with so and so symptoms. And you can have also the radiological views here, fine, about the chronic pulmonary histoplasmosis, the CT chest finding, the disseminated histoplasmosis with high clarity pictures. See, this picture itself is self-explanatory. You can very quickly identify this lesion. See, this is the patient whose skin lesions, in case of disseminated histoplasmosis. Fine. And how you can diagnose this, you can have a very beautiful picture about the histopathology where you can see some pear-shaped thin budding yeast. And finally, the treatment. See, this is how an integrated, they have started from the basics and they finally end with the treatment all in a single page. This is the special feature of using ClinicalKey. How to treat a patient with mild to moderate histoplasmosis, when there is dissemination, when there is CNS infection, and so on. Once I finish this, I will go to the table of contents quiz questions. That is whether you have read Histoplasma capsulatum at your maximum. For that, I will go to solving this multiple choice questions. See, in the table of content. Fine. See, this is one question in fungus. Actually, this is about blastomyces dermatitis. Fine. And we have also other questions here which helps us in focusing. And which helps us in revising whether we have read adequately. So I hope that with this video, it is well, clear how to use the ClinicalKey. Each and every concept, starting from our basic sciences to the clinical subject, we can learn completely and with full satisfaction with adequate clinical knowledge using ClinicalKey. I hope my video will be useful for you while reading the ClinicalKey Student and using this online application. Thank you very much.